This is In Focus, the Hindu's current affairs podcast.
I want to say it like it is. Don't take Tylenol. Don't take it. Fight like hell not to take it.
A few weeks ago, US President Donald Trump made a startling announcement. He said that using the common painkiller paracetamol or acetaminophen, which is known as Tylenol in the US, during pregnancy could cause autism in the baby. This announcement came after earlier this year, the US Health Secretary Robert F. Kennedy Jr. announced a massive testing and research effort to identify environmental toxins that he said were behind the growing epidemic of autism in the United States. It is true that more cases of autism are being reported now than in previous decades, and this is the case in several countries, including India. But is autism actually caused by paracetamol use? Why are cases on the rise? And how much do we know about genetic and environmental factors that contribute to neurodevelopmental disorders, including autism spectrum disorder? I'm Zubaida Hamid, your host for today. We dive into these questions and more with Dr. Anapadam S. Krishnamurthy, neuropsychiatrist and founder of Buddhi Clinic, Chennai. Hello and welcome to the Hindus in Focus podcast, Dr. Krishnamurthy.
Hi, Zubaida. It's lovely to be here. Thank you.
Doctor, at the end of September, the US President Donald Trump had said that using the common painkiller paracetamol, which is known as Tylenol in the US, during pregnancy could cause autism. Now, multiple studies have been conducted, we know that over the years, on autism spectrum disorder. Could you tell us what we really know about its causes?
Well, the early estimates of genetic heritability showed about 90% of autism was heritable. But a later study, 2011, from the Swedish, looking at about 14,000 children, showed that there was a 50% heritability. And we therefore have concluded over time that there's an equal role for both genes and environment. We do know, of course, that there's a male preponderance in autism spectrum, about fourfold greater in male children than in women. So we do think there's a role for genetic polymorphisms, but I think there are other environmental factors, as we will be speaking further on this podcast. It is a multifactorial condition, therefore, and I think we're looking at polygenic and de novo mutations. We're looking at a number of environmental influences that could have a role to play: maternal health, infections, metabolic conditions, pollutants, etc. And of course, there are a number of mechanistic pathways that could get involved. Immune dysregulation, for example, oxidative stress, for example, mitochondrial or endocrine disruption, for example. And of course, more recently, we've talked about the gut microbiome and the potential influences of that on autism spectrum disorder. So it's complex. It's many things which may be involved.
Doctor, is there any evidence that shows that what President Donald Trump said could possibly be true, that using paracetamol, which is, as we know, a widely used drug during pregnancy could cause the baby to have autism? Is there any strong causal link that supports this in the evidence that we have so far?
So the first point I'd like to make for everyone's benefit is that cause and effect, associations in medicine are very hard to prove. For example, one of the very few things we've proven is that smoking causes lung cancer. And that was a very long study of British doctors who were registered with the GMC and were smokers. And, they looked at smokers and non-smokers, and over a period of time, they were able to conclude. So most of what we do know is about associations and not cause-effect relationships. I mean, I think that's something that we all need to understand. Now, this whole thing about Tylenol or acetaminophen started with this ecological study in 2013 that found a strong correlation between circumcision rates and, acetaminophen exposure. But a very large JAMA sibling study the Journal of the American Medical Association, which looked at 2.48 million children, showed that there were no specific associations between Tylenol or acetaminophen use and autism, even after controlling for familial factors. However, there has been a recent systematic review, Navigation Guide 2025, which finds consistent associations between perinatal acetaminophen exposure and various neurodevelopmental disorders, of which autism spectrum disorder is a part. What we don't have any proof of is the cause effect relationship. So there is an association, it appears, but no cause effect relationship. And the advice, therefore, is that prudent, short term, lowest effective dose use is still fine when it comes to acetaminophen. Also, because it's among the safest painkillers that we can use, during pregnancy. So, at the end of the day, therefore, it cannot be completely avoided, as you will understand, for a range of reasons. But low dose use, short term exposure, and prudent use is what is being recommended at this point in time. So the answer is a little more complex than yes and no. It's a bit nuanced.
Doctor, tell us a little bit more about what you said, that association does not mean cause and effect. Why is that the case in medicine?
So it's very difficult to prove that there is something causes a certain effect in a human being, because that is epidemiological research, which involves what's called cohort studies. You follow groups of people over very prolonged periods. So I talked about the smoking study, which was done for years and years. The reason they were able to do it is because they looked at doctors who were registered with the General Medical Council UK. And as you know, a doctor has to stay registered in order to practice. So they were able to track doctors for a very prolonged period of time, and they were able to look at those who smoked and those who did not smoke. And they were able to prove by following up for, decades, that the ones who smoked had a fourfold risk of developing lung cancer when you compared them to the ones who did not smoke. Now, that kind of study is very difficult to do for a developmental condition for a range of reasons, including the fact that we don't know who is going to develop a developmental condition. So, the risk factors are not what we start with. In the smoking study, we could start with the risk factor of smoking. Here, we don't start with such risk factors. We don't know who will develop autism spectrum disorder until they actually develop it. But the best examples we have, therefore, are like the Swedish studies, where everyone is documented from the time they are born and they are followed up for life in the healthcare system. And those are therefore some of the best studies. And what those studies have shown in general is that an optimal environment is extremely important for childhood development. And when the optimal environment is disturbed, then that becomes a risk factor for developing conditions like autism, ADHD, cerebral palsy. Now, optimal environments can be disturbed right from the time a fetus is formed, which is why early pregnancy is so important and maternal health is so important. And it continues, right through the early developmental phase of a child. And of course, children, like all of us, have so many exposures during this period, which leads to all the controversies. So one example, for example, is the vaccines, that children have to take vaccines. And there have been some suggestions that vaccines can contribute to the development of conditions like autism spectrum.
This is also something that both President Trump and US Health Secretary Robert F. Kennedy Jr. have indicated about vaccines and autism. This link has been disproved, correct? So, why is this misinformation still circulating?
So I guess that the most important reason is because there is a temporal coincidence that when you develop autism, you present in the 2 to 3 year of life phase, and that's when you have taking your vaccines, or you have completed taking all your vaccines and so on. So that's one of the reasons. But just to go back to this study in 1998, by Wakefield, which was drew a lot of attention at that time, but was subsequently found to be fraudulent, and the paper was actually retracted because there were undisclosed financial conflicts and there was manipulated data as well. And in fact, the person who published it, Wakefield, lost his medical license as a consequence of all this. However, because it brought so much attention to vaccination and the development of autism, the kind of association persists in people's minds very, very strongly. And of course, there is a fair amount of media amplification and there is a distrust of institutions. All these things contribute. And I guess that, there are also political reasons, as you have been mentioning, why certain things keep coming back into public consciousness. But this is a resolved scientific question. There is no proven association between vaccination and the development of autism spectrum disorder or indeed any other neurodevelopmental disorder. Then, of course, there is this whole thing about the mercury containing preservative in vaccines, which is thought to have contributed to the development of autism. And again, this has been looked at in large epidemiological studies across the US, UK, and Denmark. And there is no proven association. And one of the very interesting thing is that, thimerosal was actually prophylactically removed from most childhood vaccines by 2001, and autism rates have continued to rise. So it really has got, probably again, in terms of lived experience, there is no suggestion that particular components of vaccines have actually contributed to the development of autism. We don't really have proof for that.
Doctor, one of the things you mentioned just now was that autism rates are rising. The Centers for Disease Control and Prevention study that came out in April and that started this entire controversy in the United States said that there had been a big increase in the number of children being diagnosed with autism in the US over the past couple of decades. And this is a trend that is being mirrored globally. Pretty much all countries are seeing this. What are the factors leading to this increase in reported cases? Is it a factor that we know more about autism now?
I think that's a very important factor. Knowledge about autism, improved awareness, and screening. People are picking this up. Pediatricians are more aware. School teachers are more aware. Counselors are more aware. So that's an important. And of course, parents are very much more aware as well. We also have broader diagnostic criteria today, and that's something that contributes. Awareness also leads to what's called diagnostic substitution. So more cases are being diagnosed as being in the autism spectrum, which might have received other diagnoses in the past. um, and then of course there is some contribution from possible environmental and perinatal factors, and this of course cannot be excluded completely, which we'll talk about as we go along. The one thing that strikes me also as being very important, and this lesson we've learned from COVID, is that sociological changes may play a great role as well. So, for example, in the Indian context, we have gone largely from extended families to nuclear families, and what we saw during COVID was a lot of social isolation for the child, because of course everyone was at home, both parents and one or two children were at home. However, the parents were preoccupied working online and they were not really available to the child a lot of the time. The child had to occupy himself, and very often that was a lot of digital exposure. And there was definitely an amplification we saw in practice of children who seemed to present with what we might have thought was features like being in the autism spectrum. And many of these children seem to have turned around once schools opened and once they started having their normal, social exposures. Things seem to have changed for those children. So I guess that is something that we really need to keep focus on. It's not part of major mainstream research at this point in time, but I think that the way society has changed globally, and especially in countries like India, this is something also that we should be looking at as one of the reasons why the diagnosis may be more common.
Doctor, what do we know about risk factors when it comes to neurodevelopmental disorders? We spoke about the fact that research has shown that both genetics and environmental factors may play a role when it comes to autism. But in general, what do we know about neurodevelopmental disorders as a whole and autism specifically? Genetics is not something anybody can do anything about, but are there other risk factors that can be taken into account?
So, one very important thing that is coming up is pollution and air pollution. For example, there have been a number of studies that have looked at elevated associations between autism and diesel particulate matter, nitrogen dioxide, and the associations seem to be stronger for the third trimester and the first year of life. And these seem to be fairly consistent. So this is something that needs to be looked at. But of course, other things like socioeconomic factors and traffic noise and other confounding factors are not completely eliminated when it comes to this. Metals, mercury and chromium and nickel, these too have been the subject of various studies, and there have been varying results. Some have shown possible associations. For example, maternal dental amalgams could be a cause. Some have not shown an association. The problem, of course, is that this is a very difficult area to study, and we don't have large scale data. And this is something that needs to be looked at perhaps a little more. Then, of course, we have data on pesticides, and of course, whether early pesticide exposure leads to neurodevelopmental conditions, including autism, and especially during pregnancy. And of course, this is a difficult factor because there are co-exposures. Say, for example, someone who lives in an agricultural area is much more likely to be exposed to organophosphates. But on the other hand, there could be other agricultural co-exposures that are confounders. And this makes it very difficult to be absolutely sure. But again, this is something that warrants investigation and needs to be looked at more carefully. Um, Other factors like maternal infections and immune activation need to be looked at. Obesity and diabetes, some medications, we've already talked about acetaminophen, but other medication exposures during pregnancy. Dysbiosis of the gut microbiome is something that keeps coming up as a possible factor. So there are several things like this that could be contributory. And when you look at gene environmental interactions, I guess if you carry a genetic vulnerability of some kind, then obviously some environmental factor can end up being the trigger. And it may not just be a direct association, it could be indirect through immune dysregulation, for example, or through metabolic activation, for example. So it's complex, but I think all these things really need to be looked at in greater detail over the coming years.
The last time we spoke, Doctor, you pointed to the need for more attention to be paid to maternal health during pregnancy and also to babies as they grow into toddlers. So, during pregnancy and after the delivery of the child. Could you talk to us about why you feel this is a very important factor?
So, one of the things, of course, is part of sociological change, industrialization, and women being an important part of the workforce, is that pregnancies are increasingly more and more delayed. And one consistent finding over the years has been that later the pregnancy, greater the risk of a neurodevelopmental condition in the child. So, this is a sort of a consistent replicated finding across studies. And I think this is something that we have to keep in mind. And as it becomes more and more common, it's contributing. Then, of course, there are other factors. We've talked about various environmental exposures, for example. But, what can confound these datas also is that, for example, higher socioeconomic status parents are much more likely to seek diagnosis, and the autism may be diagnosed more early, for example. And of course, things like smoking during pregnancy, there is non-proven but a possible association that keeps coming up. So I guess it's got a lot to do with uh, the child in the womb, the kind of exposures the child has, and the risks that inherent risks that come with certain changes of this nature, like for example later pregnancy. So I guess that's very, very important. I already talked about the concept of optimality, the need for an optimal environment for the child, to thrive. That's extremely important, and the absence of an optimal environment or anything that compromises an optimal environment, which is both during pregnancy and during the neonatal period, can really be a risk factor. So I guess pregnancy is really important, and if you go back to how people thought about taking care of the lady when she was pregnant, I think all the attention was for good nutrition, a stress-free lifestyle, very good support, uh, good mental health, the mother being happy. These were very, very important factors. I mean, one sociological trend, for example, uh, used to be in the earlier years that the woman in India would go to the mother's house for pregnancy. And one of the reasons for that was that she was removed from her own environment and the obligations came down considerably. And of course, that's something, for example, that's changed considerably over time for very obvious reasons that society is changing. And we've talked about women in the workforce. And for many, many reasons, that's no longer possible in many circumstances. So there is probably value in going back and thinking about some of these things and trying to see what we can do in the modern context in order to ensure good maternal health, good protective factors. And I think the importance of maternal health is not just physical health, but also mental health. I suspect all this is going to be very, very important as part of this whole puzzle that we have to put together.
Doctor, one of the things that seems to come out from all of this, the attempt to link paracetamol with autism, the attempt to link vaccines with autism, is that a lot of people seem to want a simple one stop answer. But in general, with neurodevelopment disorders, that isn't the case, isn't it? It's not that it's a particular form of disease and doing this or doing that could prevent it. Is that the case?
You're absolutely right. I think it's our nature as people and a society to seek for, the one thing that you can kind of intervene with, or the one thing that you can do. And I think one of the good things about all the attention that's coming to Tylenol, or all the attention that's coming to vaccination, one of the good things, there are many bad things, but one of the good things is that at least people become more aware of possible risks, and they start looking at what can I do to ensure that I have a safe environment for the child that I am planning to conceive or I have just conceived. So I think that's good. But you're absolutely right. It's multifactorial. There is gene environment interaction, and there are so many other, as we've spoken about, societal factors that play a role. And I think one should not therefore try and reduce this to a simple cause-effect relationship, because as we've spoken, those are the hardest things to prove in medicine in any case.
How do we ensure that we do not fall into a blame game by saying that the mother did not do this and therefore the child has autism or another neurodevelopmental delay? And what is the real need now when it comes to autism, specifically in India? What is the need at this point in time for care?
The first thing is, when you meet parents of children who've been diagnosed with autism spectrum disorder, there is already an enormous burden of guilt. I mean, what did I do wrong? What could I have done better, that they are facing? And you're absolutely right. It's very, very critical and very, very important that we don't add to that weight of guilt using information that is not exactly accurate. So people start thinking about, oh, maybe those 3 days that I took paracetamol would have contributed. I mean, we don't really want people to go through that kind of trauma in their minds. So I think it's very important that misinformation is avoided. and we learn to take a broader view, I think what all this brings to our knowledge is that pregnancy and right until the neonatal period, these are very crucial times, and I think it's very important that we ensure good maternal health. We limit the kind of problems that can contribute to neurodevelopmental disorders, and really from a preventive health space. During pregnancy, regular checks. Today, it's possible to make a diagnosis of neurodevelopmental disorders very early, even when the child is in the womb. And many of these procedures, ultrasounds, amniocentesis, these are very routine things that are now being done. Testing is something that we must undergo, and that's very important. Folic acid is very, very helpful in preventing disorders of neurodevelopment. And even people who are planning a pregnancy, really, I would recommend that they start themselves off on folic acid. Women, folic acid supplementation, therefore, is something that can be very protective. Making sure that adverse, exposures don't happen, I think is very important. And so, doing our best is, I guess, that's the best we can do. Is what I would recommend for everyone who's planning a pregnancy, or is in the is going through a pregnancy. Um, and I think ensuring that both the nutrition, the sleep, lifestyle, physical health, mental health, all these things are very optimal. Is probably the best thing that one can do. But of course, in modern life, we also balance this with having to work. Can't take too much time off for pregnancy. The pressures continue to be there, and I guess that we'll just have to learn to live with that as well. That it's not all going to be hunky dory. There is going to be always that little bit of a balance between what one has to do and what one hopes to do in the context of having a healthy child. I think the whole thing of once a child is born, the nurturing that happens, but I also think the socialization, the exposure of the child to other family members, other children, the opportunity to engage and socialize. I think this is a very crucial part of neurodevelopment, and I think we should not forget about that, because once the child is born, the autism or the neurodevelopmental condition often doesn't present itself immediately. There is an opportunity, I think, to also do things that are very positive for the child in the first 2 years of life.
Thank you, Doctor. Thank you so much for speaking to us today, Dr. Krishnamurthy.
Thank you for inviting me onto the podcast.
This episode was edited and produced by Jude Francis Weston. If you liked it, do subscribe to In Focus by The Hindu on Spotify, Apple Podcasts, or wherever you get your podcasts from. Thank you for listening.